Hi, everyone. Thanks again for joining our TELUS Health webinar. I'm Patrick. I'm a marketing manager here with TELUS Health. Today, Theo Douglas and Ryan Everett from our TELUS Health team will present on how to streamline communications with Med Dialog for our Wolf EMR users. They will be showcasing Med Dialog in action, and we've also set some time aside at the very end for a quick Q&A. The webinar today is muted, so if you do have any questions, feel free to ask them in the bottom right of the screen under the Q&A. We hope you're satisfied with the webinar, so feel free to reach out afterwards through our survey at the end with any feedback. Thanks again for joining. Over to you now, Theo.
Perfect. Thanks, Patrick. Welcome, everyone. My name is Theo Douglas. I'm TELUS Health National Product Manager for our Med Dialog and eFax product offering. I joined TELUS Health 6 years ago as a part of our technical support team for MedAccess EMR in BC, and have used that experience working with clinicians to help build the foundations of our external messaging products. Today, I'll be discussing streamlining your clinic's external communications with Med Dialog and eFax. With a few slides to go through to explain kind of what Med Dialog is, how it works together with eFax, and how the two can save you time and money on your external communications. We will have a demo from Ryan Everett showing how eFax is integrated into Wolf and how Med Dialog differentiates itself, and essentially just show the inbound and outbound and what that would look like for a user. As mentioned, we'll stop for a few opportunities for questions, but feel free to use that WebEx chat functionality at any time. So what is Med Dialog? Med Dialog is a secure messaging solution to communicate between providers using your existing EMR workflow. You're able to send an unlimited number of messages for a flat rate, whether they are Med Dialog messages or eFaxes. So there's no worries about overages when bundling the two together. All communication is kept within the patient chart using an integrated workflow you're already used to in Wolf. In Wolf, Med Dialog messaging is built right into your work desk component for ease of use. So what really sets Med Dialog apart from faxing is the ability to send full resolution attachments with support for documents, audio, video, and other file formats. In simple terms, essentially what quality you send is exactly what the other end receives. There's no grainy, blurry items, nothing is rotated the wrong way. If you send color, they receive color. If your document has any selectable text, it'll come through on the other end the exact same way. If the recipient you're sending to isn't on the Med Dialog network, we have our TELUS eFax solution to automatically package and send your message as a fax without any extra clicks. Med Dialog and eFax are available on your current Wolf version today. Why did we create Med Dialog? We wanted to create an open network that supports patient care dialogue between physicians, specialists, and other health professionals. We're currently supporting physicians, specialists, and any allied health professionals that use our EMRs today. So essentially anyone that provides patient care using Wolf. That includes nurse practitioners, physicians, etc. Staff like MOAs and other office staff can send or receive messages on behalf of those providers based on their EMR permissions. Today, from a network perspective, Med Dialog is fully integrated to all of our TELUS EMRs across the country, including Quebec. We're beginning to expand our network to external partners, so even beyond the TELUS ecosystem, starting with a partner that we'll discuss a little bit later. We're also looking at expanding Med Dialog to integrate to other existing networks to help create kind of larger connected health ecosystems, even outside of TELUS Health. When we were individual EMRs, this kind of solution wasn't possible, but with the backing of TELUS Health, we now have that capacity and the users to then kind of start to build this out further and work with things like provincial government networks and things along those lines. So those discussions are happening now, and that's ultimately the target of where we want to go. I know it can be a bit hard to wrap your head around kind of a concept of what is kind of the Med Dialog envelope in the middle. So a real life comparison we like to use is Interact eTransfer, which I think a lot of people are familiar with, which supports sending money between multiple banks with a single workflow. If I want to send money from a Scotiabank account to a friend's RBC account, Interact facilitates that transfer. Med Dialog is aiming to create that same type of open platform where Med Dialog is the piece that facilitates getting that communication from your clinic to another doctor's clinic using any EMR platform, and you, the end user, don't have to worry about how that's done. With eTransfer, you essentially put in their email or phone number and hit send, and Interact figures out the rest. We're aiming to do the same thing with clinical messaging. So let's go over the typical Med Dialog kind of messaging workflow. Let's pretend that you're sending a referral letter to a specialist. In Wolf, you would access that patient's chart. You would create that letter maybe in Composer, and you might print it out today, or use some sort of faxing solution, maybe a faxing program that's built into your computer. With Med Dialog or eFax, you'll still follow those exact same steps, but instead of printing that letter, we've created a new send button right in your existing workflow. We know at first most recipients won't have Med Dialog, and our industry is obviously built on fax. So when you click that send button, you don't have to think about how the message is sent. We're going to look at the recipient that you've selected within Wolf and essentially use that recipient provider information to automatically send that in the best method possible, whether that's Med Dialog or eFax. If both providers are on Med Dialog, when that provider replies to your message, the response comes back into your EMR and it's automatically attached to that patient's chart assigned to the correct physician, essentially skipping the steps of scanning a piece of paper, having to look at what the content is, and assigning it to a physician. We have the electronic information to skip those steps. This then creates a message thread, which allows you to track and facilitate that conversation, perhaps when you have multiple providers involved. In that scenario, if you're sending to another clinic that has not seen the patient before, and again, if this is a Med Dialog to Med Dialog transmission, Med Dialog is attaching the machine-readable patient demographic information in an electronic format. It's a lot of kind of technical jargon, but essentially what it means is we're taking the patient's date of birth, PHN, address information, all their latest up-to-date information, including that with the message, and sending that across so that the receiving side then can use that information to either automatically attach it to the patient chart on their end or create an unconfirmed patient chart. So essentially skipping the step of an MOA having to transcribe the PHN, the date of birth, all that information in maybe a chart summary that's coming across for a patient referral. The same applies if you receive an incoming message via Med Dialog with a patient your clinic hasn't seen. In Wolf, we then create kind of an unconfirmed chart and allow you to then import them into your local patient database. Again, a lot of information. Once we get to the demo shortly here, I'll pass it over to Ryan at that point, and he can better show how that integrates into Wolf. So Med Dialog is bundled with our eFax product, which is a relatively new product for our Wolf EMR customers. At a simple level, eFax is just sending your clinical faxes out over the internet instead of having a physical phone line in your clinic running and hooked up to a multi-purpose fax machine. eFax allows you to keep your current fax number, but potentially port your number to our eFax solution. So then you have the option of saving money in your hardware and supplies, recurring costs because you no longer need to pay that local service provider like Shaw or TELUS for a monthly fax line service, and maintaining that physical fax machine. Those are all cost savings that can come by moving your faxing into your EMR. You never have to worry about your line being tied up or sending multiple faxes at once. Digital faxing on any eFax solution essentially supports simultaneous send and receive by intelligently queuing up both your incoming and outgoing faxes. So I'm sure you've had before faxing to a clinic and the line is busy, or you have problems faxing out because your own line is busy. Again, with digital faxing, queuing that up, you're essentially lining up your faxes and sending them out one by one or receiving one by one as well. eFax is fully integrated to Wolf. Incoming faxes arrive in your documents. Outgoing faxing is done in your EMR by selecting any provider in your address book that has a valid fax number. So that's in your consultant list, and you're essentially hitting send on that instead of printing. You can verify your faxes have been sent successfully by looking at the message status, which is built into a new eFax queue right in your EMR, which Ryan will be showing very shortly here. Integrated eFax is an essential piece of this external messaging with Med Dialog because we really need the two to work together to basically send your message in the best way possible. Again, we know that most people won't be on Med Dialog on day one, so by bundling these together, we essentially send it out the best way we can. We do understand that some of you may have some sort of an electronic faxing solution today, and that's great. Where TELUS Integrated eFax sets itself apart is the level of integration into Wolf and into your Wolf workflow, essentially having that consultant list integration. So when you select any consultant in Wolf, being able to then set that destination fax number automatically and just hit send is really beneficial and a big time savings. In addition, your incoming faxes are coming right into Wolf. You're not having to import anything or place them into a network folder yourself. We import those directly into your Wolf documents through our eFax product. So I know that was a lot of information and a lot to kind of consume. So what I want to do now is pass it over to Ryan Everett, our resident Wolf expert and a part of our TELUS Health Business Consultant team, to essentially go through and share a screen and show what these components, eFax and Med Dialog, look like right in the Wolf platform. So at this point, I will we'll pass it over to you, Ryan.
Great. Thanks a lot, Teo. Good afternoon, everyone. Thanks for joining. I see a lot of familiar names in the attendee list, so that's great. Let me just share out my screen. Teo, can you let me know if you see the launch page, please?
I can, yeah.
Great, thanks a lot. All right, so as Teo mentioned, I'm going to take you guys through a demo today of both eFax and Med Dialog in Wolf. And I think an important part to start is really with this new icon that's found in the banner up here. You'll notice it's called the eFax queue. So as Teo mentioned, this is a really well integrated product. And the point of the queue up here is it's really that replacement for the log or the console that would be in existence with your current fax machine. So if I go ahead and open this up, you can see in here there's two tabs. We have an outgoing faxes and an incoming faxes. Looking first at the outgoing faxes, you'll notice here I have a list of jobs that I have sent, even as recently as this morning. I sent this outbound fax to a recent clinic that just moved over to eFax, and you can see right off the bat, status is sent. Green circle with the checkbox indicates that was a successful send. So, essentially this becomes the queue that the staff and even physicians, if they choose, this is where you would monitor to see the status of your outbound faxes. Obviously, if something's failed, we show that pretty clearly. And one of the advantages of this, if we think of that fax machine that you guys might have in your clinic now, if you've had a failed job, most likely it'll print out a piece of paper and then you've got to rely on that. And then you've got to go back to the patient's chart, find the document, reopen it, and then refax it. With this model here, you can see at the top in the banner, we give you a resend option right from here. So there's no need to go through the extra steps of finding that document. You'll also notice that there's a secondary icon in here that is an edit and resend. So in the event that you've put an incorrect fax number, just a matter of going back to edit that content and resending it. So again, it all happens within this one window. You can also see in here that we've got a view button, and that's just if you want to be able to open up and preview the content of the fax that you sent. Archive option is here as well. So after a few weeks period, it will auto archive. But if we have something on here that you no longer need, you can simply just manually archive that. So again, this isn't something that staff are expected to keep open throughout the day, but again, hop in here periodically and see the status of your faxes and then manage those as necessary. Now the secondary tab in here is your incoming faxes, and this is really just a pure log. So from here we can see what's come in, when it was received, and who it came from. Really no action or no work will occur in here. And as Teo mentioned in his presentation, we have it set up so that we manage your incoming faxes and we load those directly into the documents program. So really it's not a big departure from what you have there. One nice addition in most cases is that we actually lose the refresh or the need to refresh. It will refresh periodically. And you can see here as I've moved to the documents program, we have these items labeled fax in, and then we have the date and timestamp of the fax. So at this point, they're coming directly into the EMR, and it's sort of business as usual here. This is an area that you guys are probably fairly fluent in. You'd have the ability to link it to the patient. If it's not really destined for the EMR and it's part of the business unit, you'd have the option to go and print it out. If it's a cruise ship advertisement, we can just go ahead and delete that and do what we need, what we would normally do. So not a big departure, but again, really well integrated. But why don't I move to a patient's chart here, and we can sort of take a look at how we actually get into sending faxes. So what we've done is with this product, rather than relying on this as a print driver or a print option found in the file menu structure, we've actually created some dedicated buttons. And you'll find these dedicated eFax buttons throughout our product. First glimpse would be here in the print chart. So again, any items here that you guys would currently be printing or faxing, we've given you this new icon up at the top. And you can see here where I'm circling with my mouse, this is our send to eFax button. And the takeaway here is that, as you move into this service, as you move throughout the EMR, you're going to find this icon throughout. You'll find it at the top of your SOAP notes, in the billing program, in the reporting area, really throughout the product just to aid in workflow. Another big key area that we have high volume use is, as you guys know, in the Documents tab. So if we take a look at the Documents tab, and if there's something in here that I want to send out, let's say, for example, this to whom it may concern note, you may notice that as I clicked on it, that same fax icon appeared. And so just a matter of single clicking that, this is your first glimpse into the user interface window to send a fax. Obviously, we have the preview over here on the right. It will preview all pages of the document. So if it is a multi-page, you will be able to scroll down and take a look at what it is you're sending. But on the left-hand side is where we're doing the data entry. It will pull the username who's logged in. And then in here, we can go in and you can enter the number or the destination of the fax. And we're also offering you a subject area and a comments box as well. So why don't we go ahead and send a test fax out. First time through, I'm going to send it through as a manual fax. So again, it's manual, meaning I'm just going to type the number manually. I'll show you the address book in just a second. And you may have noticed I didn't put any hyphens, any brackets. I didn't put a 1. Just put the number straight through, and it formats it for you. And at this point, I can go ahead and just hit send. And that's gone out. Now, a couple key things that we can take note of here. If we go back to where we started and we look at that eFax queue icon, you'll notice I've got a new job in here, and it's now saying pending. So it's starting to track on this for me. Another key addition that comes along with this fax service is if we go back to the chart, you all have this icon now in your product. It came out a couple months ago, and it's a refresh button. So if I hit refresh, you'll notice now in the notes box, we've got some timestamping information. If I view that in the properties box, we can now see the name of the user. So this would be my user account, as well as the date and time and the number that we've sent it to. And just to go back to that user interface, if we do a secondary fax and we go back to the fax icon, one thing I skipped over the first time through was the address book. So if I'm not going to be manually typing, which we would hope it would be more often you would be using the book, we'll select the icon that opens your address book. And as Teo mentioned in his presentation, this product is leveraging the consultants list. So we know that all of our clinics have a fairly good consult list because you guys are creating referrals and all kinds of outbound documents. So we're just leveraging that same information that you guys are already populating. A couple notes about this though. If you look at the banner across the top here, there's the consultants button. But it's also worthwhile to point out the buildings list. So any kind of longtime Wolf users will know that we have a buildings part of the product. And this is where you can go and add things in here that wouldn't necessarily be consultants. So for example, lab companies, pharmacies, long-term care facilities. Essentially, the buildings list can become your Rolodex of all the different contacts that you guys may have a need to send faxes to. But at the end of the day, one of the advantages of pulling from the consultants list and the buildings list is that it's centralized. So it's shared across all staff members, all physicians within the clinic. Sometimes when you're using fax machines, you're dependent on the user who's logged in and everybody has their own address book. With this, it's just shared across the clinic. The other thing that we leverage in here is we're aware that a lot of our clinics who use the consultants list are often favoriting or putting a comment or putting a favorite on their most commonly used specialists. And you can see that under the consultants button, I have two tabs. I have a favorites, which again is my sort of top 20, top 30, but I also have a consultants tab. So if I'm looking for somebody who isn't on my favorites list, we're still allowing you to search for them. So a couple things to also call out in here is you may notice that some of these have icons. Now, if there's a fax icon, that indicates that we can fax to them. So again, we have the proper information found in the file, and I'd be able to pull this specialist in just by clicking their name and saying, okay. No, I'm not going to send this fax out, but you can see that it's pulled in the physician's information, and I'm able to make the send from here. So again, a lot of value in here. And maybe before I move on to the next piece, I'll just show you the buildings list as well. So if I knew I wanted to send it to a lab company, again, I can select whoever I would like, say OK, and that's now pulled in for me. Also worth noting in here is the account comment. And this is going to act as sort of a disclaimer or a if received in error type message. This is customizable by the clinic. So again, during the implementation, this is something that we can help you set up. So again, that's kind of one of the high case uses is faxing something from the Documents tab. I'm sure most of you on the line are aware, though, that from this tab, you only have the ability to fax one item at a time, and that can be obviously a challenge. One of the new features that we added last fall, and you all on the call should have this feature now, even without eFax, is our chart composer. And the chart composer allows us to go in and multi-select or pick and choose. So at the end of the day, this would be great for things like a chart transfer, med legal records, all kinds of other different options. But you can see from here, I can start to pick and choose what contents of the chart I want to send. Now, if I don't want to send any chart content, but just send documents, we have this attached documents at the top. So once again, I can pick and choose multiple documents from here. And then you'll notice we've given you an eFax button here. So again, the workflow is fairly streamlined. And again, this is a feature that you guys have now. Even without eFax, you would still have the option to print this for your standard workflow. We'll change gears once again here in the demo, and we'll talk a little bit about referrals. So we want to be able to streamline that process as well through eFax and Med Dialog. So with this patient, I'll just go into my right-click menu. We'll create a new referral. And it's going to open the familiar referral screen that you all should be used to. One notable difference, though, is at the top, we have an advanced search button now. And this is for clinics that are going to be enabled with eFax and Med Dialog. So rather than using the old consultant structure search field that you had previously, you'll notice that this is a familiar address book. It's essentially the same address book you saw me open during the fax presentation. The difference here, though, is you may note that there's some extra icons. So you'll see this little envelope. If you see an envelope next to a username, that denotes that they're part of the Med Dialog service. Now, if I was looking for my specialist, I'll say his last name is Test. You can see I've got a couple in here that are on the Med Dialog service. So if I want to select Test Doctor, who happens to be on a Med Access site, I can select them and say OK. So now my referral is addressed to our Med Dialog doctor on Med Access. From here, this is the same process that you guys are used to, creating referrals. The one piece that hinges on Med Dialog sending for referrals is that you must use the composer. Now, most of our sites have started to migrate to this feature anyway, so it falls in line. But when I go into Composer now, you're going to notice another slight difference here. Across the top, we've given you a new send icon. Now, I'm still going to go through and pick the content of the referral that I wish to send. I can still attach documents. But here, we're giving the option to send or print an eFax. So again, if this was a non-Med Dialog user and I was creating a Composer referral, I would have the ability to eFax this to them. Skip the printing, skip the faxing manually, and just do it right through the eFax service. But in this case, since Dr. Test is a Med Dialog user, I can take advantage of that and send this information directly from EMR to EMR. So we'll go ahead and do that. Okay. We have a disclaimer that comes up, and I'm still getting the option to send. Now, once this has been sent, you're going to notice up at the top, there's a status field. So you immediately know that this has been successfully delivered. At this point, I can exit the referral and return back to my workflow. Now, I should also mention that if the physician is creating this referral and their workflow in that particular clinic is such that they're not going to be the ones that send, the physician could still close the referral window. We know that it goes to the staff work desk, and from there, the staff work desk would also be able to send via Med Dialog. So it does support both workflows. Now, if we look a little bit more at Med Dialog, a few things to note here, and I'll just close the chart. You may notice that between my message in basket and my follow-up in basket, I have this external messages component. And as a provider, this is where my inbound messages from Med Dialog will sit, and also where I'm allowed to create new outbound messages. So it looks very similar to an email in basket. So again, here's my incoming messages. You'll notice that when I click on one, it reveals who it's come from, who the patient is, the body of the message, as well as any attachments that may be here. So this is a message that's come from a Med Dialog or a Med Access clinic that is Med Dialog enabled. From here, I'd have the option to reply back. I can get to the patient's chart. I can do all kinds of things that I would normally be able to do inside my own EMR. And again, if I wanted to create a new message from here, I have the ability to create new right from the top. And that may be a sufficient workflow for you. Another alternative to creating a new message might be right from the patient's chart as well. So if I just go back to that test patient's chart one last time, we can see that under the Communications tab, we've now provided a new component called External Messages. So this is going to be where all of your Med Dialog messages live. And you'll notice there's an icon here for an envelope. Now, if I click this, it's going to open that similar Med Dialog in basket view, but messages only related to this patient. Whereas back here in my 15 external messages, this is going to be clinic-wide. This will be for all of my patients that have Med Dialog messages. But again, from here, if I wanted to create a new message, if I was doing some sort of consultation with another provider perhaps, I could go new message. And this is where it looks very similar to email. In the to section, same address book again. I can look for that consultant, select them, say OK, and it's pulled in. I'll give a subject line. And of course, here's where the body of the message would be. A couple other things that we do allow for in the sending of these messages. We allow you to go into the patient's chart and attach components, things like problems, meds, surgeries, allergies, very similar to the chart compose I showed you a moment ago. We also allow you to go and look at the Documents tab of the patient's chart and attach items. So again, I'll select a couple here. Let's do a goals of care as well, and I'll say OK. So now you'll see that I've got my message along with the attachments. When I'm ready to send this to the Med Dialog provider, I can just hit send. Again, similar legal disclaimer that we saw during the referral workflow. And we'll send that out. Now again, because that's a patient-related message, that is stored on the patient's chart. So we do have a copy of that. Now, depending on the EMR that I'm sending to, whether they're Wolf, Med Access, PS Suite, that message will align in the appropriate area of that particular EMR. From there, that provider can respond or continue the workflow based on the needs of their message. So again, that was a bit of an overview of a few things that I've taken you guys through today. Took you through some eFaxing abilities, both inbound and outbound. Took you through the chart compose feature. Took you through the ability to create a new referral and send it either by eFax or Med Dialog. And then also here lastly was a couple different examples of Med Dialog messaging, both sending and receiving. So that sort of brings me to the end of my demonstration. I think what I'll do here is I'll just pass it back to Teo. Second.
Yeah, sure. Thanks, Ryan. Just before you stop sharing your screen, I just wanted to quickly highlight to those on the line, feel free to use the WebEx chat or the WebEx Q&A functionality if you have any questions. We normally would pause here just to answer a few questions while we have the EMR up and open. So, Ryan, if there's anything specific to Wolf, you could help show that. But
absolutely.
I don't see anything in the chat right now. Actually, sorry, I did get one question around sending and receiving. Can I send and receive faxes or Med Dialog on the mobile app? So, yeah, the answer to that one is no at this point today. However, we are working on integrating that into EMR Mobile this year, as that is a priority for 2020 for us. In fact, we're looking at some of the functionality. Some people on the line may have used apps on their phone where they can take a picture of a piece of paper and kind of turn it into a PDF. So kind of using the same ability for faxing or Med Dialog. So we are working on that. We got another question as well around a question of porting for eFax. You know what, actually, I'm going to save that one to the end if that's okay, and I'll circle back for that one in terms of our options for porting. We had another question. If I prefer to use Word, can I fax my documents from Word referral?
Yeah, so I'll take you through that because that's a good question. So let me just head back to the EMR. And this always brings up an interesting question, but when explained, I think it makes perfectly good sense. So let's just go back to our test patient. So since Wolf relies heavily on Microsoft Word for all of our smart forms, I think it's worth noting that if I open up a smart form, whether it be your consultant's letter or whether it be a sick note or anything, lab rec, doesn't really matter. But it's worth pointing out, let me just open up quickly here. Obviously, this is Microsoft Word's product. This isn't our product. And because we've decided to go the route of having the dedicated eFax icon, you can imagine that Microsoft wouldn't exactly allow us to go slapping our icons in their product. And that makes perfect sense. So if you are generating any kind of Word document, again, nothing changes. Still open up, check the boxes that you need to in this case, and then exit out. And as we all know, Word documents get saved to the chart. And again, it's another reason why we've added this refresh button. So if I hit refresh, now you can see that lab rec is here. And then directly from here, I would be able to fax. So, the answer is yes, any Word documents that you create, you can fax. You just can't fax them from inside of the of Microsoft Word itself. And if this was a referral, obviously the consultant's letter is going to be here. You would be able to then fax right from here, and that could be done by staff or physician. So I think that answers the question.
Yeah, that's great. Thanks, Ryan. I did see another few questions in the Q&A here. We had one that came in from Caroline asking, when sending an eFax, we only have a list of doctors' names in the from dropdown. Is there any plan to add MOA names, or is that supported?
Yeah, so let me take a look at that. I have heard that request before. So I'm logged in as a physician's work desk, and therefore my name is showing up here at the top. So again, the list, when you open it, these are provider names. If a staff is logged in, it is going to show as blank, but it will pull the clinic's name and contact number. So I can't speak to where direction of this product piece, where that's going to go. I know we have seen that request before. I have been at a couple sites where they have had a generic user work desk account, and it was sort of named, MROC Medical. Staff were then picking that, but I don't know if we're going to be including staff names at some point.
Yeah, and I can look at taking that away as product feedback. We definitely want to hear that feedback and what you'd like to see included. So that's definitely a part of my job is to take that and see how we can integrate that. So I'll take that away, Caroline. We have another question from Denise in terms of, if this is replacing our fax machine, how do we fax things that aren't necessarily patient-related, something maybe non-clinical, Ryan?
Yeah, great question, Denise. So, and we see this all the time, and we obviously speak to this during the implementation. So we do recognize that things will have to be sent out, and if you've taken away your physical fax machine, obviously that poses a challenge. So if I go back to my documents program, a comment you heard me all make in the beginning was that we put this dedicated fax button throughout the product. And we've done that no different here in the documents program. So at the end of the day, if you've got something you want to fax, scan it through like you normally would scan any other items, and then it ends up in your unlinked documents folder. So again, if it's in there, while it's highlighted, you can see down here, we've given you a dedicated fax icon. Okay. So ultimately, scan it through, it shows in the documents program, and then you just hit the fax button and send it out. Now, depending what it is, obviously if it's not patient related, there's no need to link that when faxed. And so really, you can just go in and right click and delete that when it's done. Now, even though it's not patient related, we still keep a copy of that in the queue. And obviously in this column here titled patient, it would just be blank because it wasn't linked to any particular patient. In all the clinics we've implemented, it's just a change of workflow. It hasn't really been a deal breaker. There was one site that we had, and then I think it was only because the scanning device was saved in a back room that the billing clerk only used on Tuesday. So it was just inaccessible, but otherwise it's been a pretty good offering.
And just to highlight on that, Ryan, when you click that send to fax, you don't necessarily have to pick someone from your address book. It does, Wolf does support the ability to key in, let's say you're faxing off an office supplies order or a catering order. You don't necessarily want them in your EMR address book, so just key in the fax number as free text there to send that off. Perfect. We do have another question, Denise. It's a great question that you added to the Q&A. Just for the sake of time, we only have a few minutes left, and I know a lot of people want to know about pricing and things about that. So if it's okay, we're going to move on, but we can definitely answer any additional questions at the end of the presentation here, or even connect offline via email or something to answer anything further. Perfect. Okay, Ryan, if it's okay, would you mind just presenting or sharing the presenter rights back with myself, and then I will just wrap things up here.
Yeah, I just selected stop sharing.
Perfect.
And then you should have it back. Yeah, there you go.
Yeah,
make presenter.
got it.
Yeah. And I'm going to go on mute, so take it away, Teo.
Sure. Thank you. Okay, just confirming, Ryan, or sorry, you can see the demo again there?
I can see it. You're good to go.
Okay, perfect. Okay, so just moving on, just wanted to take a quick moment to discuss revenue potential in provinces that support e-consultation fee codes. This is a relatively new thing in our space, and I'm just wanting to kind of talk about how that works with Med Dialog. Today, for our Wolf market, I think this is probably just targeting the Alberta customers on the line. In other provinces, they're not quite up to speed with these same fee codes being available, but today in Alberta, a physician can send questions about recommended patient treatment or care to a specialist or some form of consulting physician. If the specialist responds with advice or requirements around when a referral is required, and when that loop has happened kind of entirely over a secure electronic network like Med Dialog, these fee codes can be billed. Again, this is not for just sending off a referral. This is aiming to reduce the number of referrals by having a consultation kind of back and forth between a family doctor or GP and a specialist. So essentially, what would you recommend I try with my patient, or should I just refer them, I guess is kind of the idea. In this example of sending 15 e-consults per month, the referring physician would see new revenue of $5,800 or $5,990, I guess, sorry, per year. And the consulting physician or the specialist is significantly more. But even just highlighting here, the fee of $33.28 per message is pretty lucrative there, and there's definitely some new revenue potential. We do need to stress this two-way communication has to happen over a secure electronic network like Med Dialog, not over eFax. Faxing cannot be involved on either side. It would have to be Med Dialog to Med Dialog or Med Dialog to some form of secure messaging solution. This is a great incentive, though, to grow both the number of GPs and specialists on our network because there's revenue potential for both of those when they join the network. For more information, our Alberta users can call, or our Alberta users on the call, sorry, can refer to codes 0301R and 03010 on the AMA Fee Navigator website. For BC and other provinces, again, sorry, those provinces are still working on these types of e-consult fee codes, so just refer to your local ministry for when those will be available. Previously, we had talked about kind of partnering with external vendors, and I just wanted to quickly announce our first partnership with secure communications provider BrightSquid. BrightSquid is a secure messaging platform that operates primarily in Alberta and supports sending secure messaging between providers and even including patients. Med Dialog integrates with BrightSquid's secure mail platform to allow those users that are on BrightSquid to essentially send messages to Med Dialog and vice versa. We went live with BrightSquid last year and added hundreds of their providers from their network onto our Med Dialog network with that launch. Again, outside of even a TELUS EMR at all. Some of these physicians use paper-based systems. So it's really exciting for us to see this network grow and expand past just the TELUS set of EMRs. We know that a lot of our EMR users are excited about secure patient messaging, and TELUS Health does offer Wolf Patient Portal today, which supports patient messaging and is integrated right into your EMR. More information on that can come from our sales team. And so now the piece that everyone's waiting for, of course, the pricing. We do offer two plans for Med Dialog service, and these have changed a little bit over the last couple of years. So just wanted to stop quickly and run through these. The first option is our Med Dialog eFax bundle, option 1 here. This includes unlimited use of eFax and unlimited Med Dialog messaging for a flat monthly rate per provider in your clinic. This is our recommended plan because while we're still building out our network, we know that a lot of the providers you communicate with won't be on Med Dialog, so we need to have that eFax as a part of the bundle. For the $30 plan, it does require all practitioners in your clinic to sign up because the unlimited usage of fax and Med Dialog is shared by everyone. eFaxing and Med Dialog can be used by MOAs, RNs, locums, residents, anyone else in your clinic at no charge on behalf of those providers who are registered. The people who are providers that are required to register are any providers that essentially are paying for an EMR license, are a practitioner that's seeing a patient and fully owning that patient care. If you have any sort of part-time practitioners or anything along those lines, we can definitely work with you to look at what pricing works for your clinic's needs. Again, highlighting for our users in Alberta, using that Alberta eConsult fee code, if a referring physician or GP just completes one eConsultation per month, that completely pays off their cost of Med Dialog and eFax. Again, the fee code is about $33, and that completely covers your Med Dialog and eFax usage for the month. Again, for clinics who are set up with maybe rotating staff or part-time staff, sales will help put together pricing that meets the needs there. For option 2, we're looking at Med Dialog Enterprise. And so this is a newer option. And what we had heard from some of our larger clinics is that option 1 was very cost prohibitive when you have a large clinic with, say, GPs and specialists in-house and kind of a big group. So for Med Dialog Enterprise, we took away that $30 a month per provider price point, but instead put together some flat rate packages that include an unlimited number of providers that you can choose to onboard to Med Dialog, but the fax usage is then tiered depending on your clinic's needs. Again, our sales teams will talk to you and essentially look at your usage, how many providers you have, how large your clinic is, look at your full needs, and put together, kind of present the options of what's best for your clinic and for those needs. One last thing I just want to note is that standalone eFax pricing is available, but our eFax and Med Dialog bundle is priced competitively to help us build this network. It's really hard to build out a new network if you don't have anyone on it. And so in most cases, our Med Dialog bundle is kind of the most cost effective, and again, helps give you that full resolution sending, eConsult fee code potential, and all the other benefits Brian and I have talked about today. And again, our sales team can present all of those options for anyone interested. And as we're just at time here, if you have any questions, again, the WebEx chat or Q&A functionality, feel free to put stuff in there. If you would like more information, we've got the sales email address here, tellussales.emrs@tellus.com. We also have a website, tellushealth.com/meddialog, that has a bunch of great information. It's got videos showing sending from kind of med access to Wolf and vice versa. We've got a lot of great material on there to learn more and ways to reach out to us for more information. So I think I'll pause it there and just take a look to see if there's anything in the chat. Ryan or Patrick, has anything come through?
I don't see anything else, but what I can do is I'll make sure that if something does come through over the next few minutes, Theo, I can follow up with the team and make sure that somebody does reach out if you do have any questions. I'll take this time again as well to thank Theo and Ryan. It's been a really great webinar. I thank everybody for joining and have a wonderful weekend.
Perfect. And just before we wrap, sorry, I do see questions in my private chat here from Dina and Deborah. I can definitely summarize those and reach out privately for those. So we'll be in touch. Thanks, everyone.
Thank you, guys.
Thanks a lot.